The Infinity Knee System is a modular platform for ACL reconstruction that supports a variety of surgical approaches, reaming, and fixation preferences. To begin, debride the unwanted remnant ACL tissue and mark the center of the desired ACL tunnel position. Then, assemble the Infinity Modular Guide System by using the Quick Connect mechanisms to attach the femoral footprint guide arm and the all-inside guide sleeve. Place the footprint of the guide over the femoral ACL remnant and advance the guide sleeve to skin. Make a small incision to allow the sleeve to rest on bone. Next, use the Infinity Retro Reamer with an AO Trinkle attachment and the Hall Microfree Mini Driver. Insert the reamer down the guide sleeve until the tip contacts bone. With the handpiece in forward, drill through the femur until the tip is exposed within the joint. Then remove the guide body and arm from the joint. Confirm that the laser line on the reamer's distal tip is exposed, which indicates it's safe to flip the retro reamer tip. To actuate the reamer's retro mode, pinch the blue actuation cap with the index and middle finger while adding counter pressure to the wide body cap with the thumb until a tactile click is observed. Next, mallet the sleeve tip into bone until the positive stop is engaged. This will preserve a 9 mm cortical bone bridge. To observe graft tunnel length, slide the black O-ring until flush with the base of the sleeve. With the drill in forward, activate the retro reamer away from the femoral aperture and gently pull against the femur until the proper graft tunnel length is observed. A minimum of 20 mm is recommended to ensure the all-inside graft construct can be tensioned appropriately. To switch the retro reamer back to inline drill mode, pinch the blue side tabs. Then remove from the joint. To facilitate suture passing, insert the Infinity Suture Shuttle and retrieve the nitinol loop out of the anteromedial portal. Then load a passing suture and advance into the joint. For tibial reaming, assemble the Infinity Modular Guide System using the tibial footprint guide arm and the all-inside guide sleeve. Place the footprint of the guide arm over the tibial ACL remnant. Advance the guide sleeve down to skin and make a small incision to allow the guide sleeve to rest on the bone. Next, use the retro reamer to drill through the tibial plateau until the reamer's tip is exposed within the joint. Then remove the guide body and arm from the joint. Confirm that the laser line on the reamer's distal tip is exposed, which indicates it's safe to flip the retro reamer tip. Next, mallet the sleeve's tip into bone until the positive stop is engaged and advance the black O-ring to the base of the sleeve. With the drill in forward, activate the retro reamer and gently pull against the tibia until the proper graft tunnel length is observed. A minimum of 30 mm is recommended to ensure the all-inside graft construct can be tensioned appropriately. Then actuate the reamer back to inline drill mode and remove from the joint. For suture passing, insert the suture shuttle and retrieve the nitinol loop. Then load a tibial passing suture. To prepare an all-inside quad-fold graft construct, set up the Infinity Femoral Adjustable Loop button and the Infinity Free Loop on a graft prep table. With a graft approximately 28 centimeters long, place the midpoint on the Femoral Adjustable Loop button's loop and pass both tails of the graft from opposite directions through the adjustable free loop. Position the tails of the graft back so they are flush with the midpoint of the Femoral Adjustable Loop button's loop. Whip stitch the graft limbs and ensure the construct is approximately 7 centimeters in length. Then, place 4 barrel stitches on the peripherals of the construct to complete graft prep. Place the construct under tension to remove laxity and mark tunnel lengths. To tension the graft loop, apply equal parts tension on the tensioning suture with the blue suture tag and the distal end of the graft construct. If repositioning of the graft is required, first pull the blue reversible tab. Then pull the graft construct to lengthen the graft loop. To pass the graft, load the Infinity Femoral Adjustable Loop Button's lead and tensioning sutures onto the passing suture. Under direct visualization, pull the lead sutures while removing slack from the tensioning sutures until the button is seated on the lateral femoral cortex. Distal tension on the graft construct will confirm seating. To tension the graft loop, drop the lead sutures and pull only the tensioning suture with the blue suture tag while simultaneously applying distal tension on the graft construct. For tibial graft passage, load the tails of the Infinity Adjustable Loop on the passing suture. Pull down through the tibial tunnel, taking care not to remove the safety stitch. To complete fixation, place the knee in extension and use the Infinity Standard Tibial button. Attach the button down onto the adjustable loop with the centering bulb facing toward the tibial tunnel. Remove the safety stitch and pull both suture tails to tension the button to the bone. After cycling the knee and adjusting tension, use 5 overhand knots to fixate. Then remove the lead suture from the femoral button and cut the suture limbs at the skin. Cut the tibial button's suture limbs flush with the last knot. Finally, cut the reversible pull tab. This completes the all-inside ACL reconstruction.